Thank you for listening today, and I would like to discuss the effects of feeding rumen-protected lysine on cows during the transition period. And the take-home message for this research is that feeding rumen-protected lysine prepartum allowed for increased utilization of indispensable amino acids and increased glucose at calving. Now I'd like to start with a generalized view of the poster, and then I would like to go into individual components of this poster. And so I'll start with the introduction, materials, and methods. And so lysine is often most limiting for dairy cows, and by increasing the intestinal supply of lysine, specifically via rumen-protected lysine, it is also possible to increase indispensable and dispensable amino acid utilization. Additionally, by properly balancing for amino acids during the transition period, there can be an increased supply of gluconeogenic substrates and amino acids that are needed for conceptus growth and lactogenesis. Additionally, lysine is a group 2 amino acid, meaning that it's taken up in excess by the mammary gland and utilized for requirements of milk protein production. And it can also be catabolized to branch chain amino acids and dispensable amino acids, which can further be utilized by the cow. And so for this study, blood samples were taken during the pre and postpartum period, and blood samples that were utilized for plasma amino acids were taken at -7 days prior to calving, at calving, which would be day 0, and then 7 and 14 days after calving. And then blood samples that were analyzed for plasma metabolites were taken at -7, -1 days prior to calving, at calving day 0, and then 7, 14, and 28 days after calving. Additionally, we used a 2x2 factorial arrangement of treatments in which cows were either with or without lysine prepartum and with or without lysine postpartum. And this is further depicted by the schematic below, in which cows in C prepartum were without lysine prepartum and cows in L were without lysine postpartum. Once cows calved, they either stayed in the same treatment or crossed over to the other treatment, which then indicated treatments of either CC, which was without lysine pre and postpartum, CL, which was without lysine prepartum and with lysine postpartum, LC, which was with lysine prepartum and without lysine postpartum, and LL, which was with lysine pre and postpartum. And now we'll go ahead and look at the objective of this study, which was to determine the effects of feeding rumen-protected lysine, either prepartum, just postpartum, or both, on plasma amino acids and blood metabolites that are related to metabolism. And so looking quickly at the results, the top 6 graphs depict the plasma concentrations of amino acids when rumen-protected lysine was consumed prepartum. So these are going to be values during the prepartum period. And lysine was increased for cows consuming lysine prepartum. And then all other parameters that are shown, such as total amino acids, total indispensable, total dispensable, total branch chain, and sulfur amino acids were less for cows that consumed lysine prepartum. This likely indicates that cows were utilizing these other amino acids when there was a greater supply of lysine. And now I'd like to zoom in on 2 of the other figures. These figures depict plasma glucose and plasma calcium. And so we can see the figure on the left is plasma glucose, in which plasma glucose was greater at day 0, which would be calving in cows that consumed rumen-protected lysine prepartum, which could possibly be due to greater gluconeogenic substrates or a greater intake. Additionally, calcium was less for cows that were without lysine pre and postpartum, which was depicted by the CC. And this is noted by a pre by post interaction. And so cows that were consuming lysine had greater plasma calcium, which would be very beneficial to help decrease the likelihood of hypocalcemia immediately after calving. And so with that, I would like to go over the overall conclusions of this study, which were that consumption of rumen-protected lysine proved to be an adequate method to increase the concentration of lysine in plasma prepartum. However, this did not occur postpartum. Additionally, this allowed for increased utilization of indispensable and dispensable amino acids, potentially providing gluconeogenic substrates to the liver as detected by increased glucose.